We're going to do a PowerPoint on exercise at altitude and how your body and physiology changes at high altitudes. My name is Gabby Labatt. This is Danielle France. And Derek Martin is right there. And then our camera person is Mash. Or Mary Ashton Lindo. So we're going to present on altitude. Altitude is any elevation that is higher than 4,920 feet above sea level. Right here you can see different levels. There's low, moderate, high, and extreme. You can see some examples right there. There's different conditions at altitude. The atmospheric pressure decreases, therefore the partial pressure of oxygen decreases, and the air temperature decreases. We know this, it's cold in the mountains. And there's a low humidity. Your skin gets real dry, you know. And this is just an image to show that the pressure does change, and here's the change in altitudes, but the percent of oxygen in the air stays the same. The availability of oxygen at altitude, since the air is thinner, then that means there's less molecules that make up the air, therefore there's less molecules of oxygen. So at 8,000 feet, there are about 25% fewer oxygen molecules per breath that you take in. So to compensate for this, you breathe more, so your rate increases. But as we saw in the last image, the percent of oxygen in the air does not change. It's always about 21%. I'm going to hand it off to Danielle.
So exercise in altitude. Research has been conducted in many places. So expeditions at Mount Everest, which are about 8,850 meters. Simulations in barometric chambers, which have different altitudes and pressure. And at Pikes Peak Research Center in Colorado, which is 4,300 meters. So acute altitude exposure, respiratory response. Adequate oxygen supply to exercising muscles is essential to physical performance. It depends on a good supply of oxygen being brought into the body, moved from the lungs to the blood, transported to the muscles, and taken up in the muscles. So respiratory response, pulmonary ventilation. The steps leading to transport oxygen to the working muscle begins with pulmonary ventilation. Active movement of the gas molecules into the alveoli of lungs, which is breathing. It increases within seconds of exposure to high altitude and is at rest during exercise. Due to the chemoreceptors in the aortic arch and carotid arteries, they are stimulated by the lower pressure of oxygen, and signals are sent to the brain to increase breathing. In the next couple of days, ventilation remains elevated at level according to the altitude. Respiratory alkalosis. With increased ventilation, the amount of carbon dioxide in alveoli is reduced. CO2 follows the pressure gradient, diffuses of blood when pressure is high and into lungs to be exhaled. The blowing off of CO2 causes blood pressure to fall and blood pH to increase, a condition called respiratory alkalosis. So there's two effects. The first one causes hemoglobin, oxyhemoglobin saturation curve to shift to the left due to an increase in pH, and help to keep ventilation caused by the lower pressure of O2 from increasing any further. So this just shows the curve shifting to the left.
Okay, I'm going to take over again. At sea level, the pressure gradient is about 60 millimeters of mercury, but when you go up to high altitudes, it decreases to about 15 millimeters of mercury. Since there is a higher pressure gradient at sea level, that means the oxygen diffuses more easily. So when you go up to higher altitudes, it's harder for the oxygen to diffuse into the muscle tissues. This is just an image to show what I just talked about. It shows the changes in the pressures, and as you can see, the pressure gradient is 60 at sea level, and then it's about 15 at an elevation of 4,300 meters.
So oxygen transport. Inspired partial pressure of O2 at sea levels is 159 millimeters of mercury. It decreases to 104 in the alveoli because of water vapor molecules. When the alveolar pressure of oxygen drops at altitude, There are fewer binding sites on hemoglobin in the blood, making the lungs more saturated with O2. At sea level, pressure of oxygen is about 104 millimeters of mercury, and then 97% of hemoglobin has O2 bound to it. And then when pressure of oxygen is decreased to 46 millimeters of mercury at 4,400 meters, 80% of hemoglobin sites are saturated. If the oxygen loading portion of the curve was not flat, less O2 would be taken up by the blood, and as passes through the lungs, binding would be limited at altitude. Gas exchange at the muscles. So arterial partial pressure of O2 at sea level is about 100 millimeters per mercury, and the pressure of oxygen in body tissues is about 40 at rest. So the difference is about 60. Moving to elevation of 4,300 meters, arterial pressure of oxygen decreases to 42, and tissue drops to 27. Pressure gradient drops from 60 to 15, representing a 75 reduction in diffusion gradient. The diffusion gradient is responsible for driving oxygen from hemoglobin in the blood to the tissues. This change is much greater consideration for exercise performance than the small reduction in hemoglobin saturation in the lungs.
Oh, that's me.
So this is cardiovascular response to altitude. The blood volume. The volume begins to progressively decrease and eventually reaches a plateau. This plasma loss increases the percentage of hematocrit, which is red blood cells. This adaptation allows more red blood cells, more oxygen to be delivered to the muscles for giving cardiac output. The continued exposure to high altitude triggers the release of erythropoietin from kidneys, stimulating red blood cell production, which allows a person to partially compensate for lower pressure of oxygen experienced at altitude. Cardiovascular response. The cardiac output to increase blood flow to the muscles at rest and during submaximal exercise. It is accomplished through cardiac output. During the first few hours of submaximal exercise, stroke volume is decreased and heart rate is increased disproportionately to increased stroke volume and cardiac output. At maximal work levels at higher altitudes, maximal stroke volume, heart rate, and cardiac output is decreased. This makes it more difficult to perform prolonged activity at high altitudes because the decrease in cardiac output is related to the decrease in plasma volume.
Here we have the metabolic responses to altitude. Since altitude increases, basal metabolic rate due to increases in thyroxine and concentrations. It must be balanced by increased food intake. Your appetite decline is very common in the first couple of days of altitude adaptation because you're not very hungry. And anaerobic metabolism is increased, causing your lactic acid production to increase. With longer exposure to altitude, the lactic concentration in the muscles is a lot lower. Your acclimation to altitude. Acclimation can take anywhere from several weeks to several months. Moderate altitude acclimation takes usually about 3 weeks, and for each additional 1,970 feet of elevation, another week is needed for your acclimation. Here we have the pulmonary adaptations to acclimations. After about 3 or 4 days of altitude, your resting ventilation will stop increasing and will remain about 40% higher than at sea level. Your submaximal exercises ventilation will also level off. It takes longer to acclimate for resting ventilation, and it will plateau around 50% higher than at sea level. Your blood adaptations. Lack of oxygen stimulates the kidneys to release erythropoietin, which increases your number of red blood cells. More red blood cells equals more hemoglobin, which means you can carry more oxygen to your muscles. Increased red blood cells, it increases 2 to 3. Oxyhemoglobin dissociates, curve shifts to the right, which means a longer unloading portion. Your erythropoietin levels also return to baseline within a month. Your oh man, here we go. Hematocrit increases. Residents in the Andes of Peru, which is 14,000, almost 15,000 feet above sea level, is 60 to 65% hematocrit. But your residents at sea level are at 45 to 48%. Your plasma volume increases and returns back to the normal several weeks at altitude. Here we have your muscle adaptations. Your total muscle mass decreases after a few weeks of altitude. Your capillary density in muscles increases, which allows more blood and oxygen to be delivered to the muscle fibers. After 4 weeks at altitude, your mitochondrial function and your glycolytic enzyme activities of the leg muscles decrease significantly. Some of the muscle's ability to perform oxidative phosphorylation is lost, which interferes with the generalization of your APT molecules. Unfortunately, studies have shown no improvement in muscle adaptations for long life residents at high altitudes. And here is your cardiovascular adaptation. Your VO2 max does not improve with lifelong residency at high altitudes, and aerobic capacity remains unchanged from initial exposure. Here we have the live high, train low. This theory is that the body will acclimatize to the altitude by living there while training intensely can be maintained by training at or near sea level. The beneficial effects of altitude exposure are harnessed while some of the negative ones are avoided. However, residents at altitude must be there for more than 12 hours per day for at least 3 times a week. With this technique, improvements at sea level performance have been shown in events lasting between 8 and 10 minutes, but all athletes' abilities are thought to benefit.
Okay, so here we have your benefits of altitude training. First, it improves the athlete's ability to exercise by acclimating to the lower level of oxygen in the atmosphere. Some athletes go to the mountains before the Olympics so that when they return to sea level, they have a right shifted curve which improves the delivery of oxygen to the muscles. This example is the Colorado Springs Olympic Training Center. It is actually located 6,000 feet above sea level. Athletes also use masks to simulate some high altitude training. We're about to have a video that shows that right here. I don't know. We should have played it first, huh? Probably.
Oh, I can